COVID-19 infections across the country are forecast to balloon further in the coming days or weeks. To tell us more, we have Professor Jomar Rabajante of the UP Pandemic Response Team now joining us over the line. Sir Jomar, good afternoon. Prof, do you have any updated projections? When will this surge likely peak? And how many more cases should we expect?
Yes, good afternoon. From the UP Pandemic Response Team, our projection show that the possible peak might happen. Earliest is mid of January, and the latest is third week of February, with the peak size ranging from 20,000 to 40,000 reported cases. However, this is just for the reported cases. In terms of hospitalization, the peak might not be that high compared to the Alpha and Delta variant. The hospitalization might be just around half of the Delta variant, which is almost the same as the 2020 hospitalizations that we had.
Right. Does the current transmission rate already suggest that indeed it is the Omicron variant that is already going around, Professor Jomar?
Yes, there's already indication that the Omicron variant is going around NCR and some of the nearby provinces. This is because of the characteristic of the growth rate of cases. It's very fast compared to the previous variants.
Right. So, sir, if it's really fast, would that mean that the whole curve would be shorter, at least, from going up to the peak to going down? Does that indicate, at least for now, based on the examples in South Africa as well as in the UK?
Yes, actually, we are expecting like that because in terms of epidemiology, if the transmission is very fast, then we might achieve the peak earlier, and then the decline might also be faster, as what we have seen in other countries like South Africa.
All right. Now, apart from this possibly being the Omicron COVID variant going around, Professor, what other factors do you think are affecting our current COVID-19 trend?
Yes, aside from the Omicron variant, we are seeing mobility of people is one of the main reasons, especially during this December, during the holiday rush. We had too much mobility where, sadly, there's Omicron and there's high mobility. So that what happened is what we have seen now, a fast growth rate, and we hope that the alert levels and then the promotion of the DOH to really for the people to change behavior, to be strict in terms of minimum public health standards. We hope that interventions will have an impact in, so that we won't attain the projections. We don't want projections actually to happen. Yeah.
All right. Sir, we just want to clarify really quickly. You mentioned earlier 20 to 40,000 cases is likely the peak. Do you think, is this, just to clarify, this is per day? Because we already saw 20 plus thousand cases, almost 30,000 cases a day during Delta.
Yes, this is per day. Similar to what happened in Delta. In Delta, the peak is around 25,000 per day. So we also expect something like that, but a little higher in Delta, 20 to 40,000 cases per day.
All right, Professor Jomar, like you were saying, this increased mobility has led to a lot of transmission, especially over the holiday season. Right now, Metro Manila is already at alert level 3. Do you think it is likely that the shift to alert level 3 will indeed delay or decrease the expected peak of the surge?
Sorry, I didn't hear you. Sorry, can you repeat?
Right. With Metro Manila's shift to alert level 3, is this, increase in restrictions enough to delay or decrease the expected peak of the surge?
Yes, actually, this is a very difficult question because if we just have alert level 3 on paper, definitely this might not be that effective. The effective part here will be the strict implementation of the protocols. So it's not just, it should not be just on paper, but also in terms of implementation. Why I'm saying this? Because we know in terms of our new alert system compared to the ECQ and ECQ, the granular lockdown relies on the LGUs. So the LGUs should continually monitor the cases, the hospitalizations in partnership with the IATF and UAH. And also, in terms of educating people about the risk. Although Omicron variant might pose lesser risk in terms of severity compared to Delta, but still, if we have too many cases, that might overwhelm some of our hospitals. And also, for the people, even though we have alert level like this, but if the people will not go to testing labs to be tested if they have symptoms, then we cannot really monitor properly the situation. Because, in terms of monitoring, we need statistics. If people are not, getting tested, how can we have numbers?
All right. Very, very good points, sir. And good luck to all of us. Thank you so much for your time and those insights, Professor Jomar Rabajante of the UP Pandemic Response Team. Thank you, sir.